Hey y'all, so attempt 2 at making a short video. Today is June 26th, and that means it has been exactly 1 year since I had Chiari decompression brain surgery. Uh, I am now 36 years old because I had my birthday just last week, or this week. And 1 year ago, I was in the ICU after my brain surgery. So it's kind of amazing to be like, okay, I've made it 1 year. I have a lot of things I'm still trying to work on and trying to figure out, like the walking issues, the chronic fatigue, the chronic pain. I still have a ton of migraines. I also get a lot of pressure headaches, which I feel like I'm getting more than I did before surgery, but I'm not 100% sure. I wasn't as good at determining what type of headache I had before surgery, and I've been working on that a lot, really figuring it out. Um, my scar is great. I haven't had any sensitivity issues with my scar tissue or around it or on my scalp. It's tender. It's still, is a big scar and it goes deep in, but it's healed up wonderfully fine. Well, it's wonderfully fine. Like that's like yay, but blah. No, it's wonderfully great. It's healed up so well. Um I don't know. Let's see. Symptoms that have gone away completely include my downward nystagmus, where I would look down with my eyes and my eyes would shake. And also the tremor in my hands has gone away almost completely. I still have a little bit of a tremor, but it's so much better than it was. And I no longer wake up at night from my sleep, choking on my spit, which can be from brainstem compression and nerve issues. Gonna have problems swallowing, problems with the vocal cords, problems with sleep apnea, problems with choking on things, drinking stuff from that. So I haven't had that happen at all in a year. It was a very inconsistent symptom, and so I kind of gaslit myself and disregarded it and didn't really tell people about it because it was like, well, that's just weird. Okay, go back to sleep. But it hasn't happened in a year since surgery, so I'm pretty sure that it was related to Chiari, and with now what I know about other things with it, that it makes a lot of sense. So I still have a lot of other symptoms. I still have migraines. I still have pressure headaches. I still get a thrumming in my right ear. I've got some things going on with my right eye that are disconcerting that I'm going to check with another doctor about. Um, I get, I have a hard time lifting things, bending over. When I go from sitting to standing up, it'll feel like a suctioning, pulling down sensation on the back of my neck and I can feel it in my brain and in my head. It's not just in my muscles in my neck, and it will take my breath away. I will like gasp when it happens, or try to gasp, try to breathe, and it's like I have to wait a second and then I can breathe. Oh, my foot just got itchy. So, yeah, it's just been an interesting year, a challenging year. I'm still going to many, many doctors. I get my orthotic in a few days, and I have a video to post for after my last PT session last week, this past week. So that I just have to do some work on. I'm not very good at that stuff. So, anyways, I'm just trying to make this short. I've made it 1 year since brain surgery. I'm hoping I never have to go through that again. It was scary. It was anxiety inducing. I had no complications from the actual surgery, but I had a GI bleed from um, the medicines that I was taking as prescribed. And so then I had a GI bleed from that. I did have an anti nausea medication that caused my vision to go weird while I was in the hospital, but once, with the help of an online buddy, I was able to figure that out, took off the patch, the nausea medicine patch, and my vision came back. Um, I had I do think that I occasionally get some leaking, cranial spinal fluid leaking. It'll come out of the right side of my nose. Oftentimes when I change positions, but it's not an everyday occurrence. It's very rare, and I had it happening before I had surgery as well. So I don't know if what all's going on there, but it's rare, and I don't seem to get like extra headaches with it. I just go on with my day. And that's about how it was before. Sometimes I get a little lightheaded, but it seems fine. So, I have a crew of doctors, and I'm technically unable to work. I don't think I could handle going to school. I have brain fog, pain, chronic fatigue, migraines and headaches, walking issues, um, focus and concentration issues, word finding issues. So it's pretty hard to function. I never know what I'm going to wake up with every day. My sleep is terrible, despite getting 8 to 9 hours of sleep. Every night I wake up feeling terrible. But there's other things going on besides Chiari, and that I'm still working with doctors to figure out. So if someone is watching this and they're about to go through surgery, everybody's results are very different. Healing can keep taking place over a year post-op. There's a lot of stuff that the brain takes a long time to heal and takes a long time to recuperate. My brain was dealing with compression on the brainstem and on the cerebellum, probably restricted CSF flow that can cause all kinds of problems, and it takes time to heal from. So most people, when they come out of surgery, are not, I'm healed. It takes a long time. It takes time and patience, and not pushing it. A lot of people will push it, or because they either have to go back to work in some extent, or they're a parent and they have to do things, or they think, oh, it's been long enough, I can handle it, I can handle doing this activity, and then they overdo it and cause problems. I think that physical therapy should be like required after surgery. Surgery in itself is pretty intense, and then the healing process from it, new restrictions and things like that might have to be in place. So it would be lovely if physical therapy were required after a couple of months of recovery time. So, but I can't do anything about that. I got into physical therapy when I could, and I'm glad that I'm in it. I have I have 2 sessions left. And before I have to try to get approval again or switch gears, or I'm not sure what I'm doing yet, but I have to figure that out. So yeah, so this is just a quick video. I've made it 1 year, yay! And if I can do it, anyone can do it. It's hard. It's scary. It's hard. It's anxiety inducing. It can be lonely, but I think that the pandemic doesn't help with that either. Definitely played it way safer than most people, because I sneezing sneezing is quite interesting. So if I sneezing and coughing is not good. Throwing up, things like that put that whiplash effect on your neck is not good. So I've played it super safe with the pandemic to make sure that we don't get sick. Um, and even just a cold, or even just if something irritates my sinuses and I start sneezing. Yesterday, I was standing funny, got a whiff of something, because I'm very chemically sensitive, like detergents and all kinds of things like that. And I sneezed, and it messed up my neck the rest of the day. I ended up not getting a migraine from it, but it messed up my neck. And I was like, what in the world? I just sneezed. So there's all kinds of things that life is different and changed, but I'm learning so much, and I'm really hoping to keep improving and getting better. So, all right, so June 26th, and my 1 year, and I don't have anything special planned. So I'm just gonna read a book, I think. Maybe I'll go buy some cat litter. It's that kind of exciting day. So bye. Thanks for watching.